Even though we want to be politically correct all the time, there's no denying one fact. Time doesn't wait for anybody, and the impact of age does affect fertility. Infertility is a growing problem. There are more couples who are affected by it, there are more couples who are seeking help, and there are tons of people who are providing care to couples who are in that space.
When do you think is the correct time to seek advice or help from a doctor?
The best time to consult a doctor would be it's when you think about starting a family, when they've been trying to have a baby, that is unprotected sexual intercourse, for at least a year.
Hi, welcome back to the Pluro podcast, where we openly talk about the science of fertility, IVF, and starting a family. We often hear that infertility is on the rise and there are multiple factors that are affecting it. Joining me is Dr. Parikshit Tank, who is the co-founder of Pluro Fertility and IVF. So, I would like to ask you, is this that infertility as a topic has grown a lot in terms of conversations in the recent years, or it was already existing and probably now we're hearing more of it?
Thanks, Drashti. This is a very complex question, actually. I mean, when we say more people are infertile today than they were in the past, there are many layers that we need to look at. One aspect is very important, and that is the age at which couples are planning to start a family. This has consistently increased over the last, say, couple of decades. When I started practice, it was very unusual to have somebody who was 40 years old and wanted to start a family. Today, yeah, it's pretty routine. I mean, I'll see at least one or two couples who are in their 40s and they are contemplating. They're not even sure about it, but they are still thinking about whether they should start a family or not. And that's totally an individual's and a couple's own prerogative, when to get going, whether to start a family or not, so on and so forth. But even though we want to be politically correct all the time, there's no denying one fact. Time doesn't wait for anybody. And the impact of age does affect fertility. I mean, when you say, is infertility increasing? It's not only the fact that organic problems, say how many people have blocked tubes, how many people have a low sperm count. It's not only that which is increasing. It's also the age at which these problems are being discovered that leads to more couples who need help getting pregnant. So, yeah, I mean, that put together with the fact that now fertility care and people seeking fertility care are more open about that whole conversation. All that has contributed to it becoming a totally mainstream topic. I mean, we are talking about it across the dinner table. So yes, infertility is a growing problem. There are more couples who are affected by it. There are more couples who are seeking help, and there are tons of people who are providing care to couples who are in that space.
So, when do you think is the correct time to seek advice or help from a doctor?
Right. So, I mean, if one is to look at it from the perspective of holistic health, the best time to consult a doctor would be when you think about starting a family, because there's something called preconception care. This is completely different from fertility care, right? I mean, when a couple is planning to start a family, what are we looking at? We want to ensure that this particular woman is fit, she's healthy, she doesn't have any correctable medical problems, or at least we try to optimize her medical conditions before embarking on the pregnancy journey. So, if you ask me when is the right time, it's when you think about starting a family. Now, in terms of fertility, when is the right time? That depends a little bit. I mean, typically, we say that a couple has a fertility problem when they've been trying to have a baby, that is unprotected sexual intercourse, for at least a year. So, if the trying time is 1 year and they've not become pregnant, then yes, that's the official definition of fertility. But I think, there would be certain couples who probably shouldn't wait a year. If you're on the wrong side of 35, or there has been some gynecological issues in the past, say a surgery for removing fibroids or ovarian cysts, for example, then you probably should look at a consultation a little earlier in the journey. Maybe 6 months of trying and then consult a gynecologist to see where you are. Not necessarily initiate treatments, but at least to assess, how things are placed at that point in time. So again, no hard and fast answer as to, when exactly in the fertility time span a couple should consult, but 1 year for sure. I mean, that's the outer limit. Probably by then, if pregnancy has not happened, at least it merits investigation, if not necessarily treatment.
Understood. So we all have that notion that, lifestyle plays a big role as to when, you're trying to get pregnant. Lifestyle encompasses environment, stress, age, the diet patterns, all of it put together, both for men and women. So how can one navigate around that?
Wow. That's a massive question, really. I mean, so many subparts to it, right?
Yes, we can go one by one.
Yeah, let's do that. So, lifestyle is like a catch-all kind of net, and let's pick one. For example, stress. I mean, see, one thing is that there's no human being who is not stressed. We all face stress to some extent or the other in our daily lives. Maybe different sources. I mean, somebody has a tough job, somebody's got a health issue, somebody has family things, financial pressures. I mean, there's some stress or the other which is going on in everybody's lives. And to imagine that there is going to be a stress-free zone which you'll enter and then you'll have a family and become pregnant, I think that's ridiculous. I mean, it's a completely false expectation. So, stress is okay. The problems begin when stress transforms into distress. When that state of being affects your day-to-day life, what you function as, and it limits your capacity to do what you're supposed to do, then it's no longer stress, it's distress. It's bordering on a mental health condition. That can affect fertility. Now, how does that affect fertility? So, biologically speaking, for a woman, it can affect fertility because her ovulation may, switch. And she's not ovulating at the right time. Some of the cycles go anovulatory. She doesn't make an egg. The periods get prolonged. So those kind of things can happen. But more realistically, what happens with distress is that couples start having interpersonal relationship problems. They don't have sex frequently enough. Sometimes they just keep away. And all this then contributes to them not becoming pregnant. It's very distressing to hear and to say that I'm stressed. But that's life. I mean, sometimes situations do become very demanding. Those are the times when a couple will really benefit from seeing a counselor or a mental health expert, and those inputs are very valuable. They help a couple to understand that yes, there is something which is interfering with our state of mental health. There are ways to overcome it which are quite safe and they have nothing much to do with the outcomes of fertility treatments and pregnancies. And it always does not involve taking medications. It can be just therapy, it can be psychotherapy, which is very effective, relaxation techniques, so on and so forth. So, yes, stress is an important contributor, but sometimes it's not the stress which is causing the infertility, but the infertility which is causing the stress. So it's a two-way street, really.
Loop.
Yeah, it's a loop. It's a loop. And somewhere along the way, we've got to find a way to break that loop. Either get the couple to a functional state or get them pregnant. There are two ways out, of this situation. So that's like one aspect, right, of lifestyle, stress. I mean, uh, stress does not mean just being so busy. It means a lot more. And I think this is something which couples need to explore and need to accept. They need to own it when they go in for fertility treatments.
And probably seek external help and
Yeah, sure.
help them navigate through the journey.
In fact, every fertility center, every IVF center is mandated to have a counselor. And that counseling is not necessarily anything to do with, what the process is like, how much it costs, what are the outcomes. That's one aspect of counseling. But they also look at counseling in terms of their state of mental well-being. That's as important as what the body does in order to sustain themselves through that entire fertility journey.
Yeah. Amazing. So like we all have that power to kind of, overcome what we're feeling in terms of stress. And I think seeking help is one of it.
Sure.
The other factors like say environment, where you are, what you're consuming, your diet patterns.
Yeah.
How does that affect?
So let's look at consumption. Okay.
Yes.
So there aren't any particular diets or particular type of foods which a couple or a woman or a man has to take. I mean, your average diet, which typically in India is high on carbs, low on proteins, that kind of thing. And we are still 140 CR people, right? So it's not like that important a constituent of the entire fertility journey. Of course, it plays a role. But those are at the extremes. So somebody who is at the extreme of the weight range on both sides, very underweight, very overweight, then some very special attention has to be paid to diet, nutrition, so on and so forth. But for people who are in the average range, they can just go about eating what they've been eating. It won't very significantly change their chances of becoming pregnant, the way the treatments are done, and the outcomes of the treatment. Of course, I mean, any doctor worth his salt is going to tell you don't eat fried food, eat less sweets, eat lighter meals, space yourself out, so on and so forth. That's just common sense advice, right? That's not anything particularly to do with fertility. That's just normal stuff. We should have been doing this even before we came to this point where fertility is a concern, pregnancy is a concern. So barring those general advices, there's really nothing much that we need to add for the average couple. If one looks at the extremes, yes, as I mentioned, a good nutritionist can make a very big contribution. Sometimes even medications for people who are on the heavier side, those might be used as well. Besides food, the other advice that we always reiterate is stop smoking, no nicotine. And if you have a drink, it's not the worst thing in the world. I mean, let's be realistic. All the guidelines which are there in the world, they say no alcohol. But enough babies have been conceived and they later born with the influence of alcohol. So I think let's be realistic. I mean, say a glass of wine every now and then or something of that equivalent is not going to terribly affect your fertility. Please stop if you know you're pregnant.
Yeah, of course you stop.
Yeah. I mean, it's not totally science-based to say that one drink is going to change your fertility standpoint. No, it probably won't. So, what most average people do in their day-to-day lives is probably fine.
Hmm.
The alteration is that if there are extremes, they need to be regulated, they need to be brought into a narrower range.
Hmm.
So that's what we are looking at when one advises about consumption, diet, so on and so forth. Environment is again, a very
Broad.
very complex subject, because environment consists of everything that we are exposed to in our day-to-day life, right? You step out on a busy Mumbai street, and if you spend a couple of hours outside, that's like probably smoking 4 cigarettes or something. So how are you going to change that? I mean, we've no longer continued wearing masks to stop that smoke exposure and so on. So there are many small things that have been spoken about, like limiting the exposure to plastics, for example, in what you eat and drink. Like, don't store water in bottles made of plastic, rather use glass. Okay, I mean, that's good, but does it really have a direct impact on your fertility? No, because all these phenomena take years. It's years of exposure to like milk which has been coming packaged in a plastic bag.
Yes.
And if you stop doing that for a month before your treatment, is it really going to have an impact? Probably not. You want to stop doing it, fine. By all means, stop doing it. But don't expect things to drastically change by these things. They are there in the background. It's nice to talk about them, but practical application level is quite low. So focus on the bigger things. Focus on weight, diet. If you're smoking, quit. Minimize the alcohol consumption. Those are important.
Yeah.
So let's look at things which are achievable and which will have an impact.
So nothing between a vegetarian or a non-vegetarian diet standpoint.
No, not really. I mean, whatever one is used to eating,
Okay.
whatever one likes eating, and whatever suits one's beliefs. I think that's what your diet should be. Whether one is vegetarian, whether one is non-vegetarian, that's really a personal choice.
Right.
It's not as if non-vegetarians, because they consume more protein, they are going to have a faster fertility journey. No, that doesn't hold true. And equally, there are people who will say that, non-vegetarian food is very heaty.
Right.
And that's a very commonly used word in the clinic.
Yeah.
Is this food very heaty? Will it stop me from becoming pregnant? No, there's nothing like that. It's just food. So veg, non-veg, omni-veg, whatever works for you.
So no bearing directly on the fertility.
No, not really.
Understood. So we've already touched upon age, but if we go a little deeper, how does male versus female infertility be driven by virtue of age?
So here, nature's been very unfair. Men have fertility potential till they are much older. Women, unfortunately, are limited by age. And that happens once they start approaching their 40s. Then there's a drastic drop in, whether they can generate good quality eggs, become pregnant on their own, so on and so forth. On the other hand, men tend to produce sperm which is usable well into their 50s and 60s. So a stark difference in how men and women are made. They say men are from Mars and women are from Venus. So this is a very good example of that. There are certain legal limitations. The ART Act limits the age till when we can treat couples. So we cannot do any treatments for women who are older than 50, and we can't do treatments if the man is older than 55. Now, this is a legal limit. It's totally arbitrary. I don't know why they chose these numbers, but they are there.
They're there to follow.
Yeah. Do men get impacted as age advances? Yes, they do get impacted. The quality of sperm, the degree of DNA damage in the sperm, motility, all the parameters, they do get affected as age advances for the man also. But men produce millions of sperms. And out of that, even if they are not going for IVF or any fertility treatments, there's a very high probability that one good sperm is going to be enough to do the job. So, stark difference in the way we look at age as a parameter for men and for women. Yes, it affects both, but women are affected much more as compared to men. That's just how it is.
It's just biology that we can't fight.
Absolutely.
So that brings me to the end of this podcast. Thank you, Dr. Parikshit, for explaining us everything in a much more human manner, which we can easily understand and absorb. And yes, stay tuned to the Pluro podcast.
Thank you, Drashti.
Well, it was an extremely insightful session. I'm sure all of us have learned a bit more about the science of infertility. A big thank you to Dr. Parikshit for being here with us, and I will see you all in the next podcast.